With the Ebola virus having claimed 729 lives, the World Health Organization says that the crisis is out of control. But how is this going to potentially impact the United States? Today, New York City conducted its largest ever snap surprise bioterror response drill. On this occasion based around a hypothetical airborne release of anthrax, but obviously no coincidence given the current Ebola crisis. And of course, after Germany imported an Ebola victim, a US aid worker was transferred from West Africa to a hospital in Atlanta, prompting criticism as to why Western governments are deliberately bringing in Ebola sufferers when the virus has no known cure. And of course, we have to understand that it won't take an Ebola pandemic in the United States to prompt panic. Merely the suspicion of Ebola spreading in America would grind air travel and commerce to a halt. This map was widely reported today. It shows the CDC's quarantine stations, their relative positions across the country. But what most people don't realise is that if Ebola hits the US and the CDC enacts its public emergency procedures, even healthy Americans will be quarantined. A page on the CDC's official website entitled Legal Authorities for Isolation and Quarantine states that even well persons and persons who, quote, do not show symptoms can and will be forcibly quarantined. In addition, yesterday, President Obama signed an amendment to an executive order which allows for the detention of Americans merely with any kind of respiratory illness. The executive order amends 13375, which was originally signed by George W. Bush in April 2003, to state that any American with acute respiratory syndromes, including fever, signs and symptoms of pneumonia, or other respiratory illnesses, basically any respiratory illness, are subject to the original April 4th, 2003 Bush executive order, which allows for the, quote, apprehension and detention of aforementioned sufferers of respiratory illnesses. In addition, under the Model State Emergency Health Powers Act, passed in the wake of 9/11, provisions of which have been adopted in part or in full by 33 US states, federal health authorities would be able to usurp authoritarian powers to control an Ebola outbreak. And it's no surprise that at the time, the Association of American Physicians and Surgeons warned that the legislation, quote, could turn governors into dictators, because the act would empower federal authorities to seize all kinds of draconian powers, including the right to seize any and all public and private property. So given what's on the books in terms of how federal authorities will deal, remember, merely with the suspicion, the potential of an Ebola outbreak, not necessarily a pandemic in the United States, the prospective power grab that we could witness as a result of this crisis is unprecedented. This is Paul Joseph Watson reporting for Infowars.com.